One of the most stressful situations a family can find themselves in is having to arrange long term care. There appears to just be so many options that the long term care maze can be intimidating. And that's why it's so important for families not only to be educated about every option available, but to ensure that you've done sufficient research so you can make an educated decision about which option is best. Some have reached conclusions that small scale assisted living, perhaps licensed under the rules of community residential group homes or adult foster care, are insufficient for someone because they have a degree of medical fragility. But that is no longer the case. Many of these programs have exceeded public expectations and the expectations of regulators when it comes to developing just the right clinical competence. The question is, have you invested enough time into research so you can investigate whether or not one of them might just be for you or someone you love? In addition to that, it is so important that family members cooperate together. Every now and then you find a relative who tries to do it all. They take it all upon themselves in some kind of martyrdom syndrome in order to feed their own egos, or because they're insecure about the assistance of others or the generosity or sincerity of others in the family. Well, only you can decide to what extent others in the family can be of real value to you. But the common advice, and that which seems to be of greatest value, is to make an effort to trust more and to delegate more to others. Caregiving can be a real lesson in burning out, both emotionally and physically. It's also important, as we mentioned earlier, to know the options and then make the kind of decision that reflects what's best not only for you, but also the person whose care you're managing.